Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. We're going to be speaking with Mr. Mike Lipps. He's CEO of Intelerad, a global leader in enterprise imaging solutions. He's joining us to talk about why hospitals and health systems need fewer integrations to be able to truly manage their data. Welcome to Health Professional Radio. Mike Lipps, thanks for taking the time.
Neil, thank you, and thank you for having me on the show. Really appreciate it.
Well, tell us a little bit about yourself and talk about your role briefly at Intelerad as CEO.
Yeah, no, thank you. So Intelerad, we'll start with Intelerad. Intelerad is a health IT company that focuses on medical image management and being able to provide the software that radiologists, cardiologists, and other practitioners use to be able to read images and ultimately help diagnose issues for patients. And so I've joined as the CEO just about 10 months ago. My background is in software. I've spent my entire career in professional services, whether it's building software for lawyers, building software for accountants, and now in the healthcare IT space. And so something I'm very passionate about. Like I'm sure you and all of us, have a story that sort of ties us to healthcare. And you know, in my particular case, I have a mother who didn't get an image early enough and ultimately didn't diagnose an issue early enough, and that cost her some years of her life that we all wish we could have back. And when I had the opportunity to join a fantastic company like Intelerad, it was a no-brainer.
Now, are we talking all types of imaging, or are you involved in specific types of imaging media?
Yeah, no, great question. So Intelerad's history has been in radiology imaging specifically. It's a company that started 20 years ago in Montreal, Canada, great success, and one of the most scalable teleradiology platforms in the market. But now with our growth strategy here, as we pursue the next chapter of our growth and success, we've started to branch out into a sort of more end-to-end imaging strategy. We've acquired a few cardiology imaging companies to really sort of look at the sort of cardiovascular service line. And we see from a technology standpoint, really the medical image management market starting to come together, where different modalities will be able to be, the images from those modalities will be able to be stored in a universal archive that ultimately will make hospitals and health systems more efficient.
Speaking of that growth, you've made 4 deals in just 1 year, recently acquiring Heart IT, I do believe.
That's correct. We just acquired Heart IT, which is a terrific healthcare company right here in North Carolina, where I am based. And they are here in Durham. It was basically a company founded by 2 world-renowned cardiologists, Dr. Raymond Kim and Dr. Bob Judd. The Heart IT business specializes in cardiac MRIs. And one of their sort of claims to fame was they have one of the only and one of the first FDA-approved web-based browsers, which really creates a degree of portability in the cardiovascular space. And so we're very excited to acquire Heart IT. It actually builds on an acquisition we did a little bit earlier this year of a California-based company called the Medics, which makes a full cardiovascular service line solution. And we think the browser technology that we get with Heart IT combined with that full cardiovascular service line is going to create a great solution for our customers.
Now, obviously, those solutions are going to benefit your customers, as you say, but what's Intelerad doing new or different in addition to these acquisitions to further support your customers in light of the COVID-19 pandemic that's thrown healthcare into a state of disarray, for lack of a better term?
Yeah, no, it's a great question, Neil. And you think about, even before the pandemic, hospitals and health systems were under tremendous amounts of cost pressure and trying to sort of find their way through to delivering on the promise of value-based care. And, from my point of view, technology is a big part of that answer, right? Both to lower costs on the administrative side and really sort of lower their technology footprint and what they have to manage, and to create more collaboration across doctors. And, one of the great things about Intelerad is, even before the pandemic, we were a teleradiology platform. Our whole focus as a company from day one has been to build a cloud-based or a web-based platform that enables radiologists to be able to read whether they're inside the hospital or outside the hospital. And every hospital in the world right now, if they haven't already, certainly is trying to ensure that they can deliver care for patients in different formats and different mediums and different locations. And technology, to me, is the answer. And so, from an Intelerad standpoint, what we have been doing is really sort of building on our existing platform to now expand into these different modalities and ultimately now solve for more types of images, and thus making us more valuable to the hospital. If we can consolidate a number of these different PACS systems and archives that hospitals have to manage today, we're going to help them lower their costs, and ultimately we're going to create better patient outcomes.
As far as these images, they are medical data. With the explosion of telehealth, more people getting telecare, how is the security aspect of these images going to be navigated by Intelerad with this huge explosion in the need for this access?
Yeah, something that that people should always be concerned about, right? Security of their health information, and something we take very seriously. Many people don't realize that the software that we create, much like the modalities themselves, they're all classified as medical devices. And so we go through strict sort of compliance procedures and regular audits to ensure the security of the software. Now, our job is to work with our customers to ensure that they continually are focused on securing their own environments and the access to this data. And you've seen recently in the news, it is an important thing for hospitals and health systems to make sure they're investing in their security. But, the great thing about Intelerad is, for a lot of our customers, besides offering the software, we can also offer them secure hosting services as well that we manage very carefully. So if a hospital and health system decides they'd rather have somebody else manage it who is really an expert in information security, we can provide that service as well.
Do you normally remove a client's existing platform, or do you integrate into what is already there? Or is it a combination of both from Intelerad standpoint?
Yeah, it's a great question again. And it really is a combination of both. You think about the environment that a radiologist or a cardiologist lives in the hospital and the health system. Interoperability is key, right? It's critical to be able to do well, to be able to deliver a speed of response to a patient, and ultimately, for the hospital to be able to manage their costs. And so, a platform like Intelerad always integrates seamlessly into the EMR that the hospital is using. And we create a platform from an imaging standpoint. As you think about where our field is going in informatics, increasingly, analytics and AI are going to be very important in helping to create higher levels of productivity, and thus, I hope, lower levels of burnout for radiologists and cardiologists. As I'm sure you're aware, there's a shortage of those professionals today, and we would only expect that shortage gets a little bit more severe in the coming years. And so, to the extent that we can provide the backbone of sort of the imaging system and, the archives and the viewers and things of that nature, and connect directly to the EMR, so seamless flow back and forth there, and create a playground, if you will, for AI tools, we can ultimately help provide a more efficient system end to end.
Looking ahead to the second half of this year, what are you most excited about for Intelerad, and why should we be paying attention to you all right now?
Yeah, no, I appreciate it. I think Intelerad's just getting started. This is really for a company that's had the level of success and the level of delivered the level of customer value that Intelerad has over 20 years. As we now move from being radiology only into a broader solution for global medical image management, I think ultimately we can deliver a lot more value to the market. The 4 acquisitions that we've done in the first 10 months here is really just sort of scratching the surface. And as we round out this medical image management system from archives to viewers to analytics and things of that nature, I think we're going to have a profound impact on the landscape of healthcare IT and ultimately on patient outcomes. So Intelerad's definitely a company to watch in the next few years for sure.
Mike, give us a website where our listeners can learn more about Intelerad.
Fantastic. You can go to www.intelerad.com and learn all about our solutions. And if you're here in the United States, we have been building a very large presence right here in my hometown of Raleigh, North Carolina. So a lot of hiring going on as well.
Great. Mike, pleasure speaking with you. Thanks for joining us here on Health Professional Radio.
Neil, thanks for having me. Enjoy your day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Mike Lips, CEO of Intelerad. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.